Good afternoon, ladies and gentlemen. Welcome to IPMC University College podcast for the day. Myself, Asadullah, your host for today, the Enterprise Business Manager for IPMC University College. Today, we'll be taking you through the breast cancer screening and then session, how it can be early detected. So, on the podcast, we have a guest from Salvation Army in person of Miss Gertrude. She will be educating us how we can avoid it, how we can detect it in early stages. So we welcome Ms. Gertrude to our podcast today. Welcome, madam.
Thank you very much.
How are you doing today?
I'm doing very well. How about you?
Yeah, I'm also good. So we are grateful that you honored our program and then you are here with us in our podcast today. So I want you to educate our audience on how they can detect it early before it becomes or harm their body more. As we know that it's found in both men and women. So if you can give us a brief intro on that and then how we can avoid it, all those, the story around the breast cancer.
Okay. So, with breast cancer, it's just abnormal cells that develops in the breast, and then it affects the normal cells that we have in the breast. And mostly, cancer doesn't really have a cause, but we have stuff that we do that predispose us to, having the cancer cells. So we say we have risk factors. So some of the risk factors is, having a family history. Maybe you have a relative. Sometimes it can be like your grandma, your great grandma, a long distance auntie, uncle, or somebody who had the breast cancer in the family, and then it can also transcend to you as well. And then if you live a sedentary lifestyle, you don't exercise, you smoke, you drink. And then with the young women, mostly those who are always exposed to taking these oral contraceptives, the emergency ones, in a year, ideally, you're supposed to take like once. It's meant for emergency cases. But the young ones these days, because they don't want to get pregnant out of wedlock and stuff, they just take it. Some even take it every week, and it's not helping.
So sorry to cut you. In short, I would say like these current generation wants to try everything.
Yes.
Yes, so that's why it's leading to those
Yes.
cancer and all that.
Yes.
But then, does it have to do with the diet as well? Or?
Yeah, the diet is also part. That's why I said the sedentary lifestyle. We eat junk foods, we don't exercise, we smoke, we drink alcohol anyhow. So all these things predispose us to it. Yes. And then now we are fortunate, technology has advanced. Now we have x-rays that we take that can detect it early. You can do self-breast examination. And with the women, right after your menstrual cycle, you can pick a day after the menstrual cycle so that you won't forget. So in order for you not to forget, you can set a reminder on your phone that, okay, after my menses on this day, I'm going to do a self-breast examination. It's just a matter of either lying down or even standing in front of the mirror or even in the bathroom whilst you are taking your shower. You can do it with a soapy hand. You just raise your one hand behind the back. You use the remaining palm, just the 4 fingers inside it. You use it to palpate all around the breast. You are looking out for any lump. You are looking out for discharges, any discoloration, any irregular shape. Like those are the things. Sometimes you can see some scales forming around the breast and the nipple as well. So those are the things you are looking out for. So in case you see anything of that sort, you quickly go to the hospital. If you are below the age of 40 years, we take a scan or x-ray just to detect it. And then if you're above 40, we do a mammogram. So now we are fortunate. Technology has advanced, and then you don't even have to die out of breast cancer in this modern age because you can examine yourself every month. And then if you're not doing it every month, once every 2 to 3 years, you can visit any facility and they do the screening for you. And if it's detected, you are being put on treatment. And we assure you that if we detect it early, you are good to go. Because sometimes it starts as a small lump and it can be taken off without taking the whole breast off. It's when it gets to the bad stage and it affects the whole breast that we take the whole breast off. And even if we take the breast off, it doesn't affect you that much. Yes, because the breast sometimes after giving birth is just there for fashion. We are just using it to wear our clothes, and it's not there for anything else again. For like after menopause, people doesn't even get pleasure out of it anymore, like when you are young. So I think after taking the breast off, you won't die. When you go through chemotherapy, you won't die. So all these things are myths and misconceptions that we have in mind that doesn't allow people to go for screening. But now we are encouraging everyone to go for screening so that we can detect it early and treat it.
Okay. So I think what I would say is like Miss Gertrude has given us the whole process of how you can personally scan. You don't need to walk into a facility particular to scan yourself, but then you can do self-scan, which is quite easier for young people, or even grown-ups can do it. But then sometimes, there's a conception of like you saying you are doing self-examination. You might be having something, but then the best thing is to see a doctor. So how do you handle that side? Like, some people are scared of even touching their own body. Because I have an example who feels scared. Like, he feels like if he touches his body, something will happen. Or like if he even gets to, or she gets to know that if I'm aware of this, that this disease is in me, will reduce your lifespan.
Yes, that's true. That's true.
So those things, how can you like let the young generation of today understand that how they should go about it or how they should handle it?
Yes. So with breast cancer, having breast cancer is not contagious. It is not something that will kill you immediately. It's not something that will kill you immediately. So I keep telling the young ones that your body is yours. You need to explore your body. Because if you're a woman and you are not exploring your body and a man is exploring it for you, you are doing yourself injustice. Because you need to explore yourself.
Sorry, but like some of the men who go extra mile to even...
Yes, like a man will just be rubbling your body anyhow. And you yourself, you sit down and you don't even explore your body to know what is going on inside yourself.
So like, sorry to cut you once again, like, current era of social media, like we get a lot of knowledge or irrelevant knowledge from social media showcasing us like it should, which is some way or the other is not good for the generation also if we compare to what was in the past. So like that one also is harming the people these days. Yes, because all these examinations you've shown us, I'm sure on the social media also there will be posters going around how you can do it. And some of them take it on the other way around. So I don't know, like...
So now we are advocating, like we are creating awareness. That's why every year October has been set as Breast Cancer Awareness Month. And we use the whole of October, go around schools, churches, marketplace, community centers to educate our women and men about breast cancer. Now the education is going fine. I think in some years to come, we will definitely get there. People will get what we are trying to put out there.
So even like the main question I have in mind since we started the podcast is like, I've been seeing on some platforms, social media platform, like if a man sucks the breast of a lady, or maybe if it's like what they call it, I don't know in local language, say if you mia it, it doesn't
reduce your risk of getting breast cancer. It's not true.
Is it true? Is it true?
It's not entirely true because we don't have any scientific background. Like we are not having anything backing that saying. We don't have anything backing it.
Just to add, like when a baby is born, the mothers do breastfeed the baby. So that also helps the mother, or
for the breastfeeding the baby, it helps the mother. It helps the mother in so many ways. It's even a form of family planning when you are breastfeeding. Yes, but for it reducing breast cancer, no, that one it's not entirely true. We just say it.
So there is not any medical research.
No, there hasn't been any research done on that.
I think that's the question most audience were waiting for. But then
Yes.
we like, I would say, whatever you've shown us, like how they can scan, and then you've educated them. It's really helpful because current generation, the Gen Z generation, wants to try everything.
Yeah.
Even the ladies or the boys coming up in, like, they want to experiment and see what is the outcome. So I don't know how the health facilities are equipped enough to handle those kind of situations.
Now we are trying. In fact, we are really trying because at first it wasn't so easy, like getting us moving from place to place to educate people. And like you said, social media is there. We have good things and we
Yeah.
have bad things. It's just up to you, the individual, to channel what you want to read and where you channel it towards. So if you want to read about breast cancer, like there are so many like, even if you go on Google and you Google breast cancer, it will give you a whole PDF and so many knowledge about it. So we are trying. That's why I said in some years to come, we will definitely get there. It will get to a time that we are going to definitely the death rate and then the people getting it every year will reduce because the numbers keeps increasing. That is why we are also creating the awareness every year. And even after October, if you walk into any health facility that you want to be screened, we will still do it for you.
So, Madam Gertrude, we are grateful for having you on our set today at IPMC University College podcast. So, I want you to give us your last word or maybe few motivational word for the young generation or for our students on campus, how they can stay healthy in the current environment, which is not full of germs but full of experimental stuff around us, where you feel like, oh, this is this, let me try and see what is that and all that. So I just want you to throw a small light on that.
So all what I want to say lastly is that breast cancer, even though it kills, we now have treatment, and early detection really helps. We can prevent it if we detect it early. So let's do the self breast examination every month. Visit a clinic every 2 to 3 years for a medical screening as well. And also, once you have it, don't be shaken. You can read more on it from Google. When you go on social media, read the good things, the good stuff. Take care of your body. Take good care of yourself. Exercise, eat well, and reduce the drinking and the alcohol and the sedentary lifestyle. And I think with that, we are all good to go and we'll live a healthy life. Thank you.
We are grateful, Madam Gertrude, for your last word. I would also want to add, like, I read somewhere your body is a temple.
Yes.
So the way we take care of our church worship places, so you should worship your body as well also. If you want to see how your body was or how it should be, just keep one of your childhood pictures, how you were then, and then you compare it to now. You have grown, but then the surrounding or the environment around you be affecting the body, and it's all depend how you are taking care of your body. It's not somebody else who will tell you take care of your body. So I think it's really it's time that we take care of our bodies, because these days the health issues are a lot. We hear a lot of people dying at young age and all that. Very soon we'll be having more podcasts on various topics. So this is one of its kind on breast cancer awareness. I hope you are enjoying our podcast. So we thank you for coming on our podcast,
Thank you for
sharing
having
knowledge
me.
with us, and then thank you very much to the audience also who are listening to us. So see you once again. Thank you.